If you are struggling with depression, if you have a low mood, if everything feels like an effort, if you're low on energy, then this lecture might be exactly what you need, because today we're going to be covering how to use behavioral activation to overcome your depression. Welcome to the Become Your Own Therapist YouTube channel, the channel where I share the tips and techniques of psychotherapy so that you can learn how to take control of your own mental health. In other words, how can I put myself out of a job in the quickest way possible? So, as I said, today we are going to be covering how to overcome depression with behavioral activation. And if I get my slides up, you can see exactly what I mean. Okay, so a few things to unpack here. Firstly, what is behavioral activation? Well, behavioral activation you can think of as a behavioral antidepressant. It's a way to overcome depression without having to take medication. And even though this is using psychotherapy, I see the potential for it to be used by people without having to see a therapist. So we're going to cover what behavioral activation is, how this psychological technique works to overcome depression and a low mood. And we're going to do that by covering 10 principles of behavioral activation. This is not my work. This is from this textbook. A very good textbook and very practical, very helpful. So I'm going to be going through what they say are the 10 principles of behavioral activation. And I think by the end of this lecture, you're going to have a solid grounding in how to use evidence-based strategies to help your depression. Okay, let's kick it off. So firstly, am I depressed? Well, here's some symptoms to look at. If you have changes in your sleep, changes in your appetite, a low mood, if you have low energy, if you have apathy, meaning you don't really care about what's happening or your situation, maybe you feel a bit numb, maybe you feel hopeless. These are all signs that you could be depressed. In other words, that you could have a low mood. So if any of those apply to you, I think you're going to want to use these principles. And we're going to kick it off with principle 1, which is the key to changing how people feel is helping them change what they do. Okay. So in the words of a famous psychologist named Marsha Linehan, feeling down tends to elicit the behaviors that are consistent with feeling down. In other words, when you feel down, we tend to act as though we are feeling down. This means withdrawing from social situations. This means sleeping a bit more. This means not engaging in the activities that we used to find pleasurable. Okay, the reason this principle is important is because if you feel down and you behave in a way that is consistent with feeling down, then behaving as though you are down feeds back into feeling down. In other words, a vicious cycle. Okay, so behavioral activation takes this very seriously, because while it's difficult to just turn your mood up as though you had a mood knob on you somewhere, it is possible to change your behavior. Behavior is a lot more easy to change. For example, if I asked you to change how you feel about someone, that might take you a long time. You might not be able to know how to do that. But if I told you to treat someone as though you care for them, it's a bit easier to do that. You could make them food, you could give them a hug, you could activate those behaviors immediately. And so that's why this first principle is so important. It's important to notice when we feel down how our behavior changes, because all those little behavioral changes are the actual little knobs that we actually can change and that we have power over. So that is the first principle. Moving on to principle 2. Changes in life are associated with depression, and short-term coping strategies may inadvertently maintain depression over time. So this is what I alluded to in the first principle. Right. The changes in your life that occur, if you go through a divorce, if you lose a loved one, if you've been through some sort of trauma, those will cause a shift in your mood. And that's normal. That's totally human. If you're beating yourself up for feeling low in a difficult situation, then you're being quite hard on yourself, because that is the nature of being human. Tragedy happens, negative things happen, and you don't have to, during winter, have the leaves, growing on the tree. You don't have to be thriving at a time when you should be surviving. So all of this first part of the sentence, changes in life are associated with depression, is to just normalize that for you. Okay. The problem is more likely the maintenance of the low mood over time, feeling depressed for months, for years after some tragedy has happened. And that is usually not the result of the actual event, but the result of the ways that you coped with the initial short-term tragedy. So this is where principle 1 comes back in, right? Feeling down tends to elicit behaviors that are consistent with feeling down. So you might feel low after a breakup, but then because of that, you stop going out with friends, you withdraw socially. Because you've withdrawn socially, you feel even more alone, you feel even more sad, and the more sad you feel, the more you withdraw. And so the cycle continues. So this short-term coping strategy of withdrawing is not helpful because it keeps your mood lower, whereas you might have had some good conversations with friends who had gone through a similar breakup. Or you might have done things out with them, watched a movie that you enjoyed. All these little things that could have brought you pleasure are no longer there. Okay, so we are to focus on the short-term coping strategies because that's what maintains the depression over time. There's no use in trying to get people not to feel sad for losing a loved one or going through a trauma. That will happen. That will affect your mood. So we're going to focus on the second part, which leads to principle 3. And this is where we really get practical in terms of what can we do with this knowledge. So the clues to figuring out what will be antidepressant for a particular client lies in the ABCs. Okay, let's go through what the ABCs are. A stands for antecedent, B for behavior, and C for consequence. Okay, so I'm going to leave the A and C for now. Let's just focus on B. Behavior. So think of B, the behavior, as being anything that represents the depression. So it could be being quite critical with yourself, feeling hopeless, your appetite being reduced. Okay, so you need to identify all the behaviors that are consistent with being depressed. In other words, the short-term coping strategies. Once you identify those behaviors and you break the depression down into these little building blocks, you can then ask yourself, what happens just before the depression and what happens just after it? So if you're feeling down, check in with yourself. What was the A, the antecedent? In other words, the thing that happened just before the depression, right? It could be, if you're feeling quite self-critical, it could be that you logged onto social media just before. So the behavior of feeling self-critical was preceded by scrolling through social media. So social media becomes the A, and then the B is being self-critical. And then maybe when you're self-critical, you don't want to go out in public because you are judging yourself. If that's the case, then not going out in public is the consequence. Okay, so the antecedent A here is scrolling through social media. The behavior is then feeling self-critical. And C, the consequence to that is that you don't go out. Okay. Now, it's important to realize that A and C both influence the behavior. So whereas it might be difficult to just stop feeling self-critical, it's easier to maybe not scroll on social media or maybe to follow different pages on social media. And with C, perhaps even if you feel self-critical, you could still go out so that the low mood doesn't inflate over time. It gets smaller over time. So you see, by addressing the antecedent and the consequence, we can actually shift the thing that's in between, which is the behavior. In other words, the depressive symptoms. So that's what principle 3 is all about. And this is where I'd urge you to get practical. So the first thing you're going to do is write down all the times in which you feel depressed or which you feel symptoms that are related to depression, like changes in sleep, changes in appetite, all the things we covered in that initial slide. And then you're going to ask yourself, you're going to draw 2 columns on either side of these symptoms. On the left, you're going to write down what happened just before these symptoms. And on the right, you're going to write down what happened just after them. And then you'll be able to do an ABC analysis of your depression, and you might realize that you have control over the consequences and that maybe you have some control over the antecedents as well. Okay, moving on to principle 4. Principle 4 is all about structuring and scheduling activities that follow a plan, not a mood. So just think about this for a second. If you feel down, you don't feel like exercising, you don't feel like going out with friends. Now, most people behave according to a mood rather than according to a plan. Most people, when they feel down, they don't go out. If they feel the craving for certain food, they eat it. Okay, and we're designed this way, we're all like this. There's no judgment related to that. But when you are depressed and when you are behaving according to the feeling of depression, that can cause that feedback loop that we spoke about earlier. So this is an alternative. Okay, principle 4 is a practical guideline about what you can do instead of behaving according to that mood, which is flipping this on its head. Instead of feeling a certain way and then behaving in accordance with that feeling, you first behave in the way that you want to, even if you don't feel like it, and then let the positive feeling follow. So I think we've all had this experience of not feeling like working out or not feeling like doing an assignment or something challenging, but then doing it anyways, and then seeing how relieved we feel afterwards, feeling a sense of accomplishment, feeling like, yeah, I hit that workout. So that's an example of where you might have acted in a way that was not consistent with how you felt, but consistent with what you wanted from life, consistent with your values, consistent with the structure or plan that you put in place beforehand, so that your emotions don't just dictate your decisions and your behaviors day by day. So here's the practical bit with principle 4. Use principle 4 to draw up a plan for how you need to behave when this low mood arises. Because as you've probably noticed, these things come in waves. Sometimes they are persistent, especially if it's severe, but these things often do come in waves. So you need to be ready for that wave. You need to have a plan or structure in place dictating the things that you are going to do so that you can actually behave in those ways and not just follow your mood. If you don't have that plan or structure in place and you don't commit to certain activities beforehand, when the mood arises, you're just going to flow with that mood, which is what causes the feedback loop as we've discussed. So that is principle 4. Principle 5 is very important. It's something I see in my clinical practice a lot, is that when clients are trying to help themselves through some sort of mental struggle, they often go for the top shelf. I do this as well. I'm also guilty of this. When we feel low, we want to fix it immediately. And this sense of urgency arises. And tell me if this isn't you, but every time you fail at something, the need to conquer it gets stronger and stronger, and the self-frustration and self-criticism grows, and so does the sense of hopelessness. Okay, we want to avoid that. And how we avoid that is through principle 5, which states that change will be easier when starting small. It seems so simple, but we don't do this. We don't do this when it comes to our mental health. If we feel socially anxious, we feel like we have to throw ourselves into a party, which is like the Olympics of social anxiety. You don't need to get into the Olympics. You can just start running with friends, So if I bring this back to the depression example, you don't have to start with extremely complex behaviors to overcome the depression. If you've realized, okay, since I've started feeling depressed, I've stopped going to the gym, I've stopped socializing, you don't suddenly need to commit to an hour of gym 6 times a week and to seeing friends every weekend. Okay, you can start with going to the gym for 30 minutes twice a week. Okay, and often a good tip here is whatever you think is small, go smaller, because in my experience, people think that whatever activity they need to instill in their life, they think that it can't be reduced or can't be broken down into a small activity. So I'm going to challenge you, if you're thinking about an activity that you probably should start doing again, something you used to enjoy or something that gives you a sense of accomplishment, whatever you're thinking of, see if you can half that. Okay, you can half it along the time, the intensity, the frequency, however you make it smaller, okay? And don't be ashamed by that. It should be so small that it seems ridiculous to even commit to that, okay? But if you're feeling like, wow, this is so small, this is ridiculous, then you're probably in the right space there, okay? So use principle 5 to sort of put boundaries around principle 4, because principle 4 can become this ambitious thing of, I'm going to schedule all these things in and my day will be scheduled, the whole 24 hours. And, if that's starting to happen in principle 4, what's going to happen to is you're probably not going to live up to that because you're being too perfectionistic, and then you're going to fail at it, and then you're going to feel more hopeless and more depressed. And we don't want that. Okay, maybe that's partly what you've been doing this whole time. Maybe this whole time, it isn't that your situation is hopeless, but that you feel hopeless because you've been setting the bar so high that you never could have succeeded in the first place. Okay, it's okay to start small. It's okay to be a beginner at this. The next principle is principle 6, which is to emphasize activities that are naturally reinforcing. Okay. What reinforcing means is it's any activity that expands itself. It's any activity that makes you want to do it more and more just because of the inherent joy in doing it. An example is if you enjoy a sport, right? Let's say you enjoy playing football, and then you play football. While you're playing football, you will feel feelings of enjoyment. Maybe you'll feel feelings of accomplishment. And it's these feelings that naturally reinforce the activity. So it's the inherent joy, the inherent sense of accomplishment that comes with that activity that makes you want to do it more and more. Some things you might not enjoy, something like studying, for example. Most of us don't enjoy studying, even if we want a degree, even if we're passionate about the field. Sometimes you don't feel like studying or you don't feel like doing an assignment. In those cases, that activity isn't naturally reinforcing, okay? But you can make it reinforcing by adding a reward at the end. So you can say, if I study this much, I get to go out and have a drink with friends. That would be an example of something that is unnaturally reinforcing. So here what we suggest when you're feeling low is to choose activities that are naturally reinforcing, the things that naturally make you feel good. Okay, that's different for everyone. So don't Google a list of these things. Don't ask your friends. Think about your own personal history. That will give you the best bet at knowing what's naturally reinforcing for you, because that's what you need to focus on. Things that are naturally reinforcing for you and that have worked for you in the past. Then we're taking an evidence-based approach to this because you're looking at your life experience. So look at activities that are naturally reinforcing. And things that are reinforcing make us feel good in the moment. They're enjoyable to us. They're pleasurable. They give us a sense of accomplishment while we're doing it or after we've done it. So go for those rather than activities that you don't enjoy. Principle 7 is to be a compassionate coach. So this book was written for therapists. So this was a recommendation to the therapist to be compassionate while doing this. But this can be applied to yourself as well. Even if there's no therapist, we also have a relationship to ourselves. We can be critical toward ourselves. We can be kind. We can be compassionate. We can be judgmental. So check that relationship to yourself here. It's important that you be compassionate toward yourself on this journey. And by compassionate, I don't mean soft. By compassionate, I mean being in tune with the suffering of what you're going through. So either your suffering or the suffering of someone else, that's what compassion is. It's not being soft. So you need to be a compassionate coach toward yourself. People often think that being compassionate toward themselves is not a good thing, because being compassionate feels like you're going easy on yourself or you're not being as productive. But research shows that people who are compassionate toward themselves are actually more productive. So it's a bit counterintuitive. We feel like we need to use the stick to beat ourselves into doing things. But people who are happier and who enjoy what they do get more done, and they have longer term success. You can beat yourself into doing something for a bit of time and maybe it'll work effectively. But if you want long term success, if you want to treat your life like a marathon, then you have to be compassionate toward yourself, and you have to go easy on yourself and enjoy what you're doing and choose activities that are naturally reinforcing and support yourself. It's okay to criticize yourself if it's constructive and if there's support added to that. Without support, criticism serves no function. Okay, so that's principle 7. Principle 8 is to emphasize a problem-solving empirical approach and recognize that all results are useful. So what we mean here by, firstly, I'll take problem-solving, then we'll discuss empirical. What we mean by problem-solving approach is that you are going to encounter problems as you start to try to engage in behavioral activation, as you analyze the ABCs in your life, as you try to create a structure and a plan, as you start engaging in these activities. You might engage in an activity and something goes wrong. Maybe you don't enjoy it. Maybe it ends up making you feel lower. Instead of taking a problem-focused approach here, you need to take a problem-solving approach. If you try an activity that you thought you enjoyed and you try it and you didn't enjoy it, and it wasn't naturally reinforcing, then use that problem-solving mind of yours. Think about, okay, that wasn't reinforcing. What else could I try? Where could I take this? What exactly went wrong here, and what are the alternatives that I could use? Okay, because problems will arise. And if you are ready to give up on this process as soon as a problem arises, you probably won't be successful in the long term. And that's definitely what the research shows, is that people who take a problem-solving approach, who are ready to encounter challenges and ready to digest them, process them, and then take a step forward despite those problems, those are the people who have long-term success with any sort of therapy. So firstly, take that problem-solving approach. Secondly, make sure it's empirical. Empirical just means that your eyes are on the ground. You are looking at what is actually happening throughout the process. In other words, you're not theorizing, you're not thinking about, oh, this ought to work, or this should work, or according to this theory, this should be helpful. But rather, you're looking at, was this actually helpful or not? What are the actual results of what I'm doing? You see, because being in touch with the actual results of this whole process going forward will allow you to notice when there are problems that you could problem solve. It will allow you to notice what's working so that you can double down on it. And it'll allow you to look at what's not working. Okay, so overall, being empirical, being grounded in the actual outcomes of what you're doing will take you further, because it's not based on ideas. It's not based on figments of imagination. It's based on reality. That's what being empirical means. Okay, so if we move on to principle 9, it's to listen, to understand, and to remain action-oriented. Okay, so in terms of the listening and understanding, in this textbook, that related mainly to the therapist's role, to listen and to understand what the client is saying. So you can do that for yourself. Listen to yourself throughout this process, understand what's going on. But the more important part here is being action-oriented. There's no point in engaging in behavioral activation if you don't act, right? It's all about the behavior. So don't learn too much about behavioral activation. This slideshow should be enough for you to get started. The most important thing is that you do get started, that you put this stuff into action. So I think that's pretty self-explanatory. So the last principle is just to troubleshoot possible and actual barriers to activation. Okay, this seems obvious, but I'd like you to think about this in this way. There are many barriers that could show up to engaging in behavioral activation, and some of them might be psychological, but others could be purely practical. Okay. Think about something as simple as you decide to start going to the gym again, and in the mornings you don't feel like getting dressed. You could have your clothes laid out the night before in front of your bed or on your bed, all ready for the workout. And that might actually, just that little tweak in your environment might make you more likely to go to the gym, to work out. Okay, so be very creative here. Think outside the box. Think very practically. Think very psychologically as well. Think about any possible barrier to this. There could be so many little things in just the way your home is structured, in the relationships that you have. There could be many things that are causing little barriers, making life a bit difficult to engage in these activities. What you want to do is you want to identify those barriers, and then you want to make sure that whatever the barrier is, you are removing them and making this behavior as easy as possible. You should remove so many barriers that it's almost difficult not to engage in this behavior. That's sort of the test to know whether you're removing these barriers. It also says, notice there, possible barriers as well. So there's something about anticipating these things as well. Some things you can anticipate. Other things you'll have to run into these problems, but other things you can think ahead, for example, like a gym or whatever else you're doing. So my question to you is, what are you going to do today? Because I think that's the most important take home. Maybe you're listening to this quite late and maybe you'll need to start tomorrow. That's okay. But if it is daylight, if there is some time after this lecture, what are you going to do today? Maybe you need to identify your symptoms of depression. Maybe you need to analyze when they show up and when they are not there. Maybe you need to do an ABC analysis of these things. Maybe you have already tried to activate these behaviors and you just need to reignite that. Maybe you need to create a structure and a plan for your behaviors. Maybe you need to think of alternative behaviors that you could start engaging in. And maybe you need to increase your self-compassion about the whole process. Maybe you've given up because you've made it a bit too difficult for yourself and you need to make things a bit easier. Whatever it is, make sure that you do something today. And just know that I really believe in these techniques because there's a lot of research to back up that they do work for people. They don't work for everyone. And if your depression is severe, there's no shame in getting medication. There's no shame in seeing a therapist. But if you are feeling low, I would suggest giving this a go. And even if you feel hopeless, just remember, I'm not asking you to see the light at the end of the tunnel. I'm asking you to turn the light on. I'm asking you to act.